An exclusive interview coming up. Hi, I'm Allie Cook for the Dental News Network. Today is September 23rd, 2015, and this is your Wednesday Watch. Here's today's dental news. We're very excited to bring you an exclusive interview this week. I just sat down with Dr. Dean Mersky, president of Optin Dental Advantage. We talked about effective competition, patient advocacy, and more. Here's our conversation. Hi, it's my pleasure to be joined now by Dr. Dean Mersky. Dr. Mersky, welcome.
Thank you.
Thanks for joining us today. Tell us about Optin. What is it and why was it launched?
Well, Optin is an organization dedicated to private practitioners. We launched it because private practitioners without an organization of their own are losing patients, losing money, losing profits. They have no representation. In contrast, the DSOs, the dental schools, the insurance companies, even community health centers, they all have organizations, and so we're helping private practice compete against those organizations and the entities that make up those organizations.
Aren't private practices already competing?
Yes, they are, but they're very disadvantaged. Take, for example, a DSO with 400 offices. They might spend maybe $20,000 a month just on social media marketing. That comes out to about $50 per office. Or a cheap dinner for two at Texas Roadhouse once a month. That's a huge disadvantage for private practice.
So Optin helps practices compete more effectively.
Yes, we do. We aggregate the buying power, we aggregate the marketing power for the private practice. For example, real-world example, our members were able to purchase 1,000 brochures, full-color brochures, for $100 each. Now, that would have cost an individual practice $4,300. So we cut costs quite a bit so that things can get done. But on a larger macro level, on average, each private practice is losing approximately $150,000 a year in annual revenues to competing DSOs. Now, if that practice was to take that money each year and invest it at 5% for 10 years, they would accumulate $3 million. This is no joke. But if we're just looking at it every day, we don't see that. But when you look at the big picture, that's a pile of money to give away.
Absolutely. Well, in what ways does Optin Dental Advantage influence consumers in ways that individual dentists can't?
Well, individual dentists don't have the wherewithal, most often, to effectively brand themselves in a strong way up against a national brand. So we give them brand power. We have a website dedicated to consumers. That's optindentaladvantage.com. And there we present ourselves as trustworthy patient advocates. Now, a dentist is going to have a hard time branding themselves by saying, "Trust me, I'm ethical." Yeah, that's impossible. That'll push people away. It doesn't work. But we get that done. And as patient advocates, we can endorse that dentist. And this works. Nielsen's research shows that 60% of patients prefer a brand that's familiar. We are that familiar patient advocate brand.
Well, you've used that term a couple times. I want to ask you more about that. What is patient advocacy and how does that fit into this picture?
Yeah, we are very strong patient advocates, as are the dentists who are members. We are outraged by what's happening in the industry today, the patient abuse, the games that insurances play. All of that we speak out against in a very strong way, while others are shrinking away from it. Nobody wants to talk about the crazy uncles that we have. We do.
Do dentists know and understand these concepts?
Well, yes, that's a great question. We all think we know. The truth is there's a knowledge gap. We only know what we see. There's a tremendous amount of knowledge behind marketing and branding that we don't know. And for example, if I was to say Flow, you would know it's progressive.
Sure.
Everybody knows that Coca-Cola is the real thing, and they recognize that Nike swoosh. The big companies that private practices compete against are using those tactics against private practice, while private practice has no brand. It's a concept. And we give them that brand. we give it a familiar name that patients will recognize, so that private practice can compete on an even level.
Well, in closing, one last question. You're a dentist. What would you like to see dentists doing?
Well, we need to get past this whole idea of individuality and independence, because it's really a misconception. Long ago, we were highly independent, but now almost everybody is submitting their fees to insurance companies and taking whatever they pay with absolutely no alternative. We need to aggregate our power, and when we do, we'll have tremendous power to market. And that's the important thing that I hope people understand. We've got to get this done now, because branding takes time. We can't wait till the water's up under our nose. That's too late.
True.
Practices will collapse. We've got to get it done now while there's still time to get it done, and put a footprint on there for private practice into the marketplace. One last thing. We dentists like to think that we can fix things, and we fix a lot of things. But we've proven we can't fix this problem. And I hope that people will realize that, come together, pull together, so that we can take this private practice to the forefront of the consumer's thinking, and appreciate all that the good dentists have to offer.
Well, thank you so much. I know a lot of our viewers will be interested to learn more about Optin. Where can they go for more information?
Yes, thank you. We have two websites. One is the dentist, and one is for the consumer. The dentist website is Optin, O-P-T-I-N, dentists, plural.com, and that's where we're speaking only to the dentists. And then there's the consumer website, where we speak to the consumer, and that is Optin, O-P-T-I-N, dentaladvantage.com.
Okay, Dr. Mersky, thank you so much. And as always, for more on Optin, you can keep it right here at dentistrytoday.com.
My pleasure. Thank you.
Thanks for checking out the Wednesday Watch. We'll see you next week with more from DNN and Dentistry Today.